I see patients with both type 1 and type 2 diabetes.
It's been years since physician assistant Charlotte Burns first walked into the Cray Diabetes Center at the University of Kansas Health System, and it was much earlier than her first day on the job. She was a patient.
I was diagnosed when I was 19 years old. It was my first semester of college.
She says the signs were there before her diagnosis: unexplained weight loss, having to use the restroom constantly, and always being thirsty. But she and her parents didn't know enough about the disease to know the signs.
Nobody in my family ever had any inkling that I would be diagnosed with type 1 diabetes, especially when I was 19. We have no family history of type 1 diabetes.
The diagnosis changed what she chose to study in school, and it changed her daily life.
I constantly am thinking about what my blood sugar is, about every 5 minutes throughout the day. Throughout the night last night, my blood sugar was running low, so my glucose monitor was alerting me and my parents and keeping both myself and my parents awake most of the night.
If left untreated, high blood sugar can have a myriad of devastating consequences, including heart damage. The National Institutes of Health says over time, high blood sugar can damage the blood vessels and nerves controlling your heart. The CDC says if you have diabetes, you're also more likely to have other conditions raising your risk for heart disease, like high blood pressure, high cholesterol, and high triglycerides. And the American Diabetes Association says adults with diabetes are twice as likely to have a heart attack or a stroke compared to people without diabetes. Charlotte says the age at which people develop type 1 diabetes is getting older.
I personally have friends and patients who have been diagnosed with type 1 diabetes in their 40s, 50s, 60s, and 70s.
And there are many theories as to why.
So my kind of leading thought is that there must be something environmental that is triggering something within our genetic code to flip the switch to turn your immune system on to attacking your beta cells in your pancreas.
No matter the cause, her message to her patients is what her doctor first told her when she was diagnosed at age 19.
She said, "Are you going to control your diabetes, or will you let diabetes control your life?" I think it's better to think that you can control your diabetes rather than letting it control your life for you.